How many PRP treatments are needed if you have knee arthritis? Hello, this is Dr. Siddharth Dambar, physician and expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. Question asked of me on one of our social sites recently was, how many PRP injections is typically needed for knee osteoarthritis? In this individual's case, he's in his mid to late 60s. His orthopedic surgeon had recommended PRP treatment to him, recommending that he get injected once every 2 weeks, 3 times. And the question is that appropriate? Let's talk about it. Let's first and foremost talk about how do these treatments work and what is regenerative medicine. So regenerative medicine is the process of taking your cells that are normally involved after an injury, let's say your own platelets or your own bone marrow stem cells, injecting it into an area that's been damaged to start that normal kind of healing process in an area that's been chronically injured and not healing very well on its own. So in someone that has a chronic arthritic knee joint, they have a couple things going on. Number one is they have some degree of chronic instability from prior strains or injuries to the ligaments that is now putting more stress on the knee joint. And number two, they also have a certain degree of chronic inflammation in the joint. This may not be massive inflammation like you see in a condition like an autoimmune condition or an infection, but it is a low level of inflammation that can cause sometimes swelling in the joint that is generally causing pain in the joint. So when we utilize an orthobiologic treatment, and that can be prolotherapy, platelet-rich plasma, or bone marrow-derived stem cells, this is how you generally want to utilize treatment. After the initial treatment, you cause an acute degree of inflammation for the first few days up to the first week. That is a good thing. Your body's normal way after healing or trying to recover from an injury is through acute inflammation. When people have chronic inflammation, meaning for months to years, that's problematic. That is the body's inefficient and incorrect way of trying to deal with pain. Acute inflammation is different. The cells, the growth factors, the cytokines involved in acute inflammation are meant to recover from the injury, clean up the injury, and then cause a progressive process of healing. Chronic inflammation doesn't work like that. Chronic inflammation is the wrong way to deal with pain. So after an orthobiologic treatment, again, in this case we're talking about platelet-rich plasma, there's a few days to a week where you have switched from chronic inflammation to more acute inflammation. After that settles down, that inflammation phase settles down, you then have a proliferation phase, where now you're pulling in your mesenchymal stem cells in the area that's been treated are now pulling in other cells, growth factors and cytokines and fibroblasts to start laying down the tissue that is involved in recovering from that injury. In that process, you now have additional cells that are slowly working, which then goes on for about the next 4 to 6 weeks. And then lastly, you have a remodeling phase, which can then take a few months, where now the tissue is being optimized, strengthened, and progressively fine-tuned to lead to more stability and reduce inflammation over time. This whole process takes a few months after that treatment or after an injury. So when I hear someone is getting recommended treatment every 2 weeks, there's a couple things that come to mind. Number one, this physician may not understand how these treatments appropriately works. That's possible. The other is that they may be utilizing a low concentration of platelets. So in general, to get a true platelet-rich plasma treatment, you need to be aiming for 5 times the normal concentration of platelets in the fluid that they're injecting or higher. In fact, when I'm treating, let's say, knee joint with knee arthritis, we're using anywhere from 10 to 20 times the concentration of platelets. So a much higher concentration of platelets. When you do that, you need to let this play out over a few months. And in fact, normally when I'm treating somebody, I'll tell them, look, it's going to take about a month before you start noticing some early benefits, and you're then going to have progressive improvement over the next 6 to 9 months. And if we're thinking about doing a second treatment, I would recommend we see where are you at that 6-month mark or further. When you do that, you're now giving this individual time to appropriately heal and progress and recover from that treatment based on not only what we see clinically in patients, but what also makes sense from how you normally heal after an injury or through acute inflammation. When someone is using a very low concentration of platelets, let's say 2 or 3 times concentration of platelets, number one, that's not even really what platelet-rich plasma is properly defined as by experts in the field. But when you use such a low concentration of platelets, you need to redose more frequently. So in that person that's getting, let's say, a 3x platelet-rich plasma treatment, doing treatment every 2 weeks, 3 times, will eventually give them about a 9 times concentration of platelets. The thing is, that's inefficient. You don't need to do it split up over 3 treatments. You can do all of that during 1 treatment and get a better and more efficient outcome longer term. So when I hear someone is getting 3 treatments, I think they're probably not getting an ideal treatment. I think they'll probably get some benefit. That's what the data shows, and it makes sense also mechanistically, but I don't think they're getting an ideal or most efficient treatment. Hope that was helpful. Any other questions, please let me know either on any of our social sites or at chicagoarthritis.com. Thank you for your time and live well. Bye-bye.